Please introduce yourself to the jury.
Good afternoon. My name is Dr. Charlie Skinner.
Dr. Skinner, before we get to your life care plan, I'd like to go over your background. Where did you go to school?
I attended the University of London, but I guess I spent too much time in the library. I didn't pick up any fancy British accent while I was there. However, I did receive a bachelor's in psychology, in medicine, and in surgery. I also have a degree in public health from Harvard.
After you came back from London, where did you work?
I worked for Tufts New England Medical Center in their nephrology department.
And what is nephrology, Dr. Skinner?
Nephrology is a specialty of medicine that concerns itself with the study of normal kidney functions, problems with kidney functions, and replacement of kidneys, this particularly being dialysis and kidney transplants.
And where do you work now?
Currently, I work at Brigham Women's Hospital in Boston, Massachusetts.
Have you held any teaching positions throughout your career, Dr. Skinner?
I did. During my time at Tufts New England Medical Center, I started off as an instructor there and quickly became an associate professor.
Have you received any awards throughout your career?
I've received multiple awards in my different fields, both as a teacher and a physician, but mostly and most recently, I've received an award in 2013 for the Life Care Planners Achievement Award.
Your Honor, this time, pursuant to stipulations 14 and 15 agreed upon in the pretrial hearing, we'd like to remind the court that Dr. Charlie Skinner will be testifying as an expert in today's case in the fields of nephrology, the study of kidneys, and life care planning.
Any objection to those fields?
No, Your Honor, it's pursuant to the PEC and I am not allowed to object.
All right, please continue.
Dr. Skinner, did you create a life care plan for Reese Lansing?
I did.
And what is the purpose of a life care plan?
The Life Care Plan is a comprehensive document that outlines a patient's medical future. It discusses all the services and treatments a patient would need based on any conditions that they have. We like to think of this as the roadmap for a patient's healthy well-being in the future.
Dr. Skinner, were you compensated for your time in preparing Reese's life care plan?
Yes, my normal hourly rate of $375.
Are you prepared to present your life care plan today to the jury and explain your conclusions?
Absolutely.
Before we get to the plan itself, I'd like to talk about what you looked at to create the plan. What method did you follow in creating Reese's life care plan?
I followed all the methods and standards outlined by the International Academy of Life Care Planners.
What materials did you look at?
I reviewed all of Reese Lansing's medical reports at both Allister City Charity Hospital as well as Allister Presbyterian Hospital, and including any doctor's notes. I also reviewed depositions in this case, including Reese's parents, the other doctor in today's case, the economist, and one of Reese's biological parents. In addition to all these documents, I also applied my experience and expertise.
Dr. Skinner, did you have sufficient facts and data to render an opinion in this case?
Yes, I did.
Did you use reliable principles and methods?
Absolutely.
Did you reliably apply those principles and methods to the facts of this case?
I did.
Dr. Skinner, what were you able to determine about Reese from looking at his medical records?
Based on his medical records, I've learned that Reese was, I learned that Reese had a genetic mutation called polycystic kidney disease, or more commonly known as PKD.
What is PKD?
PKD, as I said, is a genetic disease, so it's an inherited disease from his biological family. And PKD replaces normal kidney tissue with fluid-filled cysts. These cysts start to expand, which causes the kidney to go into kidney failure and eventually stop working.
Dr. Skinner, just to be clear, is Reese's PKD currently symptomatic?
Objection needed.
Overruled.
Currently, Reese is not symptomatic with PKD, but as of the day that Reese was born, he was already pre-exposed with this disease.
Dr. Skinner, do you have an opinion based on a reasonable degree of medical certainty on whether Reese's PKD will in fact become symptomatic?
Yes, it is my opinion to a reasonable degree of medical certainty that Reese will in fact become symptomatic. We typically see PKD manifesting itself around the 4th decade of life, and it can be completely debilitating.
Now let's turn our attention to some of the lab reports. What specifically stood out to you in the lab reports?
Based on Reese's lab reports, I found two main areas of concern. The first was Reese's glomerular filtration rate, or more commonly known as GFR. The second area of concern was his cholesterol levels.
Let's start with GFR. What exactly is that?
GFR is the best indicator we have of kidney function. In a perfect world, a GFR is 100, meaning that the kidneys are working perfectly, 100%. However, any number less than 100 means that the kidneys are working less than ideal. Therefore, if they were working at a 45, they would be only working 45% of their capacity.
Your Honor, I'm showing opposing counsel what has been marked for identification purposes as Exhibit P1. May I approach, Your Honor?
Yes.
Dr. Skinner, do you recognize this document?
Absolutely. This is one of the blood test results I reviewed of Reese Lansing in 2011.
And when would this document have been created?
This document would have been created as soon as Reese's blood test results came back at the hospital of Alster City Presbyterian.
And how did you go about retrieving this document?
I contacted Alster City Presbyterian and asked them if they had any medical files of Reese Lansing, and they faxed this over to me.
And Dr. Skinner, did you rely on this document in formulating your opinion in today's case?
Absolutely.
At this time, Your Honor, we offer Exhibit P1 into evidence.
Any objection?
No objection.
It is entered. P1.
Yes, Your Honor.
Continue.
Dr. Skinner, on that report, what were Reese's GFR levels?
Based on this 2011 report, Reese's GFR levels were at 75, meaning they were only working 75% of their full capacity.
Why is a GFR of 75 concerning for a person like Reese, a person with PKD gene?
Well, like I explained earlier, they're only working 75% of their full capacity. To look at it in the inverse, that means 25% of Reese's kidneys were damaged.
Beg your pardon, Your Honor. Dr. Skinner, knowing what you know about PKD, would you expect someone's GFR to fluctuate?
Now, in everybody, GFR gradually decreases as we age, and that's a typical thing we see. However, to see GFR levels bounce from low to high, that's pretty concerning. We can't have a damaged kidney then replace itself. If it's damaged, it's going to be damaged forever.
Okay, Dr. Skinner, moving on to the cholesterol levels that you mentioned before. Why are cholesterol levels important in determining kidney health?
Cholesterol levels are a lead indicator for cardiovascular disease, and unfortunately, we see many patients with kidney failure die of cardiovascular disease.
Dr. Skinner, on that report, what were Reese's cholesterol levels?
In 2011, Reese had a cholesterol level of 232.
What is considered a normal cholesterol level?
We typically like to see a person's cholesterol less than 200.
Now that we've talked about the lab reports, let's talk about the life care plan itself.
Absolutely.
First of all, Dr. Skinner, did you make any assumptions in creating your life care plan for Reese?
Yes, it's typical in life care planning that we make a few assumptions. The first basic one is the life expectancy of a patient, and then the second one is to talk about their conditions or any health problems that they have.
Your Honor, this time we'll show in opposing counsel what has been marked for identification purposes as Exhibit R8. Permission to approach. Dr. Skinner, do you recognize this document?
Absolutely, I created it. This is the life care plan I created.
Your Honor, pursuant to stipulation 11, which states that expert reports are admissible, we offer Exhibit R8 into evidence at this time.
Is that an expert report pursuant to that stipulation?
Yes, Your Honor, but pursuant to Federal Rules of Evidence 106, I request that the entire report be entered into evidence instead of simply the last page.
Is there more to this report than this page?
Yes, Your Honor, that is the last page of an 8-page report. That is the summary that summarizes everything that was said in the entire report.
And why should the document in its entirety not be omitted at this point?
The entire document can be omitted.
All right, pursuant to their objection, if you could just omit that entire document.
Okay. One moment, Your Honor. Your Honor, I'm showing opposing counsel what has been marked as Exhibit R for identification purposes. Permission to approach. Dr. Skinner, do you recognize these documents?
Yes, I also created these documents.
At this time, Your Honor, also pursuant to stipulation 11, we offer the entirety of Dr. Skinner's life care report into evidence.
Any further objections by the defense?
No, Your Honor.
All right, they will be omitted, and this is exhibit what?
That's Exhibit R in its entirety. The first one is Exhibit R8.
Okay.
At this time, Your Honor, we've prepared a blow-up of the summary Exhibit R8, and I ask permission for Dr. Skinner to come down off the stand and have it explained to the jury.
All right, no problem. And you may reposition yourself if necessary.
Dr. Skinner, you good?
Perfect, thank you.
Okay, Dr. Skinner, if you could you please just describe the general layout of your plan summary?
Absolutely. As you mentioned earlier, there are a few assumptions we have to make in today's case, and I outline these at the very beginning of my summary. This is that at the approximate age of 35, Reese Lansing will become symptomatic with PKD. The second assumption is, based on the Bureau of Labor Statistics, that Reese will have a life expectancy of 79.3 years of age. Now after that, we list all the possible needs and treatments that Reese will need with his PKD. Additionally, how frequent and at what length of time he will need these things, and the cost for each itemized treatment and service.
Let's break this down into a timeline.
Sure.
How old is Reese Lansing right now?
Reese currently is 16 years old.
And Dr. Skinner, how long is Reese expected to live?
As I said before, based on the Bureau of Labor Statistics, Reese is expected to live to the age of 79.3.
And in your opinion, how old will Reese be when his PKD becomes symptomatic?
Again, the second assumption I made in today's case was that Reese would become symptomatic around the age of 35.
Dr. Skinner, what treatment will Reese need from now until the rest of his life?
It's a very good question. In fact, Reese will need several things. First, Reese is going to need a checkup with his nephrologist on a regular basis. In addition to this checkup, Reese is going to have blood tests done on a regular basis. And finally, we advise that people with possible kidney disease meet with a dietitian. And I'm going to use green to represent Reese's lifetime.
Dr. Skinner, how much will these treatments cost Reese?
All these treatments are outlined individually, but as a whole, for his entire lifetime, these treatments will cost him $121,824.
Moving on to age 35, when you've opined that the PKD will become symptomatic, what treatment will Reese need at that time?
From the age of 35 need to be put on dialysis. And in order to be put on dialysis, Reese will have to have the dialysis port surgery. Now, dialysis is only a temporary solution, so eventually Reese is going to have an actual kidney transplant. And in order to administer the dialysis, Reese will need a nurse.
Dr. Skinner, what is dialysis?
Like I said a second ago, dialysis is only a temporary fix to kidney failure. It's where a machine is hooked up to a person through a port in their arm. This connects the artery with the vein and filters the blood through a machine to remove any waste product, basically performing the function of the kidney that it can't do.
Dr. Skinner, in your opinion, again based on a reasonable degree of medical certainty, how long will Reese be on dialysis before he needs a transplant?
Reese most likely will be on dialysis until he is 42 years old. And I indicated this period of time in red because this is a very critical and debilitating time for Reese.
What are you basing your 7 years of dialysis opinion on?
And this is based on the common practice of how long it takes to find a kidney donor. Furthermore, Reese is an O blood type, which makes him the most difficult donor to find makes him the most difficult recipient to find a donor.
Dr. Skinner, what is the total cost of the treatment in red, so the treatment from age 35 to age 42?
During this most critical time, the total cost of all these surgeries and nurses will be $2,122,912.
Finally, Dr. Skinner, for the last category of Reese's life, what type of treatment will he need from age 42 until the rest of his life?
Now, like I said before, dialysis isn't a permanent solution, and hopefully Reese is able to get a new kidney. Well, once he gets this new kidney, he will have to make sure that his body doesn't reject it. And in this case, he will have to have excuse me, my marker's dead. Will indicate after the transplant in orange. He'll have to have anti-rejection medication administered for the rest of his life.
And how much will this anti-rejection medication cost Reese?
This will cost him $634,100.
Okay, Dr. Skinner, if we take the totals from each phase of Reese's life, what is the total amount in cost what is the total cost of the treatment Reese will need?
Well, all these numbers come from my life care plan. And as you can see at the bottom, we list the total here. This is just formatted in a timeline situation. So the total cost for Reese would be $2,878,866, dollars.
Thank you, Dr. Skinner. You can return to the witness box. I have several questions for you. Several more questions for you. Dr. Skinner, how many kidneys does Reese currently have?
Currently, Reese only has one kidney.
And why does Reese only have one kidney?
Reese only has one kidney because Alster City Charity Hospital performed an unauthorized surgery removing his second kidney.
Objection, Your Honor. 403.
Response.
This is very probative. This is the whole reason that we're in courtroom today. Furthermore, Your Honor has granted summary judgment on the basis of liability that the hospital's removal of Reese's kidney was illegal and was statutory battery.
Now, since we've already ruled on this and this is bifurcated and just being damages, how is it relevant to say that that was unauthorized at this point?
I don't care about her going into the authorization of the surgery. I would like to elicit from her why Reese only has one kidney now, whether or not the surgery was unauthorized or not.
So what we're gonna do is we're gonna strike her saying it was unauthorized, but you can continue on that line of questioning that you mentioned, so.
Why does Reese now only have one kidney?
Reese only has one kidney because he was a donor and his second kidney was placed into Taylor Warren as the donor.
Now, we were talking about PKD earlier. What is the difference in fighting PKD with one kidney and fighting PKD with two kidneys?
Well, it's very different. In fact, the numbers when we were talking about GFR and the full capacity, well, full capacity of two kidneys is much more than the full capacity of one kidney. So the numbers make the amount of damage and the amount of time that Reese would go into kidney failure much quicker and much more severe.
Thank you, Dr. Skinner. I have no further questions. Your Honor, I'd like to mark this whiteboard as Plaintiff's Exhibit R9 to be used in closing arguments.
Are you preserving this?
Yes, I'd like to mark it and preserve it.
Are there any objections to that?
No, Your Honor.
All right, it will be marked, and it's just this document that's being marked and preserved.
Yes, Your Honor.
All right, and do you intend to use these on cross-examination, the demonstratives?
No, Your Honor.
All right, please remove them.
Good evening, Dr. Chair.
Good evening.
Dr. Skinner, you stated that part of your opinion in this case was based on various test results.
Yes, the blood test results of Reese Lansing.
And there were 3 different sets of test results, correct?
Correct. I believe it was 1999, 2011, and most recently 2014.
Right. Now, and specifically today you discussed both GFR and cholesterol especially.
Those were 2 numbers that appeared on the blood test results. There were several tests run in these blood test results, but those were the areas of concern I focused on.
So let's start off with the GFR levels.
Sure.
Now, GFR has a permissible range, basically anything equal to or greater than 90 is acceptable, correct?
Always we would like to see it closer to 100, but from 90 to 100 is the permissible range.
Now, when Reese was, I believe, 1 year old, his level was 97.
Correct.
And the issue that you have is with his GFR level back in 2011, and that was 75.
Yes, it was. It was very concerning.
However, by 2014, the level was back up to 90, correct?
Yes, it was back up to 90. However, as I discussed earlier, this fluctuation is not a good sign. Because Reese's kidneys were already at a depth of 75, meaning that 25% of his kidney had been in failure, it's impossible for that 25% to reconstruct itself in the 2-year difference or the 3-year difference of 2011-2014. So the numbers shown in 2014 were inadequate at best.
But it did go back up to 90.
It did.
Now, you also discussed his cholesterol levels.
Yes.
And Reese has pretty much always had high cholesterol, right?
He's always been on the higher range, but that could be based on his dieting habits or due to stress.
So when he was 1 year old, his cholesterol level was 95.
Yes.
And in 2011, it jumped to 232.
I believe in 1999 it wasn't 95, it was 195?
I'm sorry, 195.
195, and then in 2011 it spiked up to 232, which was very high for his age.
But again, in 2014, it dropped to its lowest level yet of 180.
It did.
Now, I know you didn't discuss it today, but in your report you also discussed the importance of creatine levels.
Creatine levels are very important. It's actually one of the numbers that goes into calculating the GFR rating. So it was taken into consideration just in a different form.
In fact, in your report you state that creatine has been found to be a fairly reliable indicator of kidney function. Elevated creatine levels signify impaired kidney function or disease. Abnormally high levels of creatine thus warn of possible malfunctions or failure of the kidneys. Correct?
Creatinine levels are very important and are indicators of kidney disease. In fact, Reese's were substantially high at some points, and these numbers are taken into a mathematical equation to give us the GFR rating, which is the best indicator.
Now, when Reese had his test back in 1990, well, first, the permissible range for creatinine, or however you pronounce it, the permissible range is 0.5 to 1.4, correct?
That is correct, and Reese was at that highest level back in 1999 when he was only 1 year old. That's very, very high for a creatinine level of a mere infant.
Then it dropped by 2011 down to 1.3, correct?
Luckily, it did drop for Reese in this scenario.
And then by 2014, it dropped again to 1.1.
It did, however, his GFR levels in 2011 and his cholesterol
Objection, Your
levels.
Honor. Beyond the scope of my question.
Please limit your answer to yes or no and then a brief explanation, okay? So please re-ask the question.
And move to strike.
Yes, we'll strike that and restart there.
So in 2014, his creatinine levels were down to 1.1.
Yes, they were.
Now, all of these blood results and all these tests were all done before the kidney transplant, correct?
They were.
But you weren't able to review any results for after the transplant occurred.
I don't believe that Reese has had any blood test results done, any blood test analysis done after the transplant.
So since there weren't any tests done, you weren't able to review them, so you don't know if any of these levels have changed since his
Objection,
results.
speculation.
Response?
Your Honor, it's not speculation. I'm asking if she's been able to review these things, and since she hasn't, she can't speculate as to any effect.
Your Honor, she's asked once if she's reviewed it, and she said no. Anything other than that will be speculation.
All right, we're gonna limit this just to if she has or hasn't, one brief question and then move on, okay, Counselor? So sustain, but we'll move through this.
Thank you, Your Honor.
So you haven't been able to see if his results have changed at all since the kidney transplant?
I have not, since there were no tests performed afterwards.
Thank you, Your Honor. No further questions.
Any redirect?
No, Your Honor.